Hello, everyone. This is the DiGo Talks session on comparative analysis of healthcare delivery and psychiatry training in India versus Australia. And this is Dr. Divyam Goswami, along with my dear friend and colleague, Dr. Bhavya Bhansali, organizing this talk. And we have with us Dr. Anuneet Sabharwal joining us from Perth, Australia. And he is currently pursuing his fellowship in Royal Australian New Zealand College of Psychiatrists. He has worked as a consultant psychiatrist for 9 years in India, and he'll be completing his fellowship this July. So welcome, Dr. Sabharwal.
Thank you for having me.
Yes, so we would straight away start with the question and answers. So can you just give us the general structure of psychiatry training, and even before that, like we have MBBS or undergraduate training here in India. So what do you have in Australia?
Oh, the Australian system is very similar to the one that we have in India. They call it MBBS here as well. I think in Australia, there's two ways to get into MBBS. One is directly after school, just like in India. And then the other way is that you do pre-medical in college and then enter MBBS later. I think it's very competitive if you directly want to enter MBBS from school, which is why most people end up taking MBBS after finishing off their bachelor's before that. So those are the two pathways to get into med school here, as far as I'm aware.
Okay. And what about getting into psychiatry training? So do they have entrance exams over there in Australia, or like we do have in India, or there's some other system?
Mm-hmm. Well, the Australian system is extremely difficult if you've passed your MBBS in India and then moved to Australia. I think it has one of the toughest exams that you have to crack. So it's very similar to the USMLE pattern, but it's much more tough and has a much less pass rate. So it's basically AMC1, which is a theory exam, and then the AMC2, which is a practical exam, which has about a 15 to 20% pass rate. And then once you do that, you work as a registrar, non-trainee registrar in the field of your choice. Once you develop an interest in a specific field, so in this case psychiatry, you can then start applying for the training position. So it's interview based. It's not based on a competitive exam, but the whole idea behind getting into training is for you to have been under supervision and the supervised practice, have referees, and it's very, very thorough, and it's much more thorough than what you would, because in India you just take an exam and then get into psychiatry, but over here they're constantly monitoring you for 1 year, 2 years. There are people who take 3-4 years before getting into training because there's only limited positions, and you keep interviewing, and they will have their own candidates with PRs and citizenship are always given priorities, and then so on and so forth. Things become much easier if you've already finished your postgrad in India, because then you go through a different pathway altogether. So if you want to do training straight away from MBBS, then it's a 5-year pathway. But if you come as a specialist, then it's very different. It's completely different. So I'm on the specialist pathway, which is a different pathway. But I'm aware of how the other pathway works as well.
So you mentioned that it is difficult for somebody migrating after doing MBBS from India, but is it same for the Australian graduates as well?
Well, the thing is, the process is the same, but all Australian PRs and citizens are always given priority. It's the law here, right? So they will only fill vacant positions with, let's say, international graduates for a training position if no PR or citizen is interested in that position. That's the first thing. The second thing is Australian graduates don't need to take AMC1 and AMC2. AMC1 and AMC2 are basically filtering exams that you have. They filter out all the average students, and only the best enter Australia into the healthcare system. That is not something the Australian grads need to go through.
Okay. Then you also told about the non-trainee registrar. So Is it equivalent to junior resident here in India?
Mhm. Yes, it is. It is. But like I said, before you enter even a non-training position, you still have to clear your AMC1 and AMC2,
Okay.
right? Unless you've already passed your post-graduation in India. That's a different scenario altogether.
Yes, so you're saying that in Australia, if you are going after MBBS, then you have to pass your AMC1, AMC2, and then you have to do a non-trainee registrar job, and then you get into the fellowship program.
Correct. And the fellowship is 5 years over here.
Oh, so it's a long stretch program if you want to become a psychiatrist in Australia.
Well, I mean, India has 3 years plus 3 years of a senior residency, so it's 6 years in India if you look at it that way. Uh,
But
Similar over
most of the
here.
people don't do 3 years of senior residency.
So that's in that aspect, I think India is much better because
Hmm.
really after the fourth year or so, you end up starting to kind of see a lot of repeat patients, and the whole sort of training aspect becomes, at least from the Indian context, a little less intensive in just the training bit. I think in that aspect, I would say India scores over Australia is because I think 3 to 4 to maximum 5 years should be enough for someone to end up as a consultant. I think in India, the flexibility of finishing off 3 years and then that flexibility of joining as a consultant in your own private practice is a nice arrangement. I myself finished about 4.5 years. So 3 years of training plus a year and a half of senior residency, and then I started my own practice. So uh, in my own experience, I felt that a year and a half of senior residency was enough. But again, like that calculation in the end comes down to about 5 years.
Hmm. Yeah. So, following up on this question, what would be if I tell you to compare and contrast the structure of residency training here in India versus the structure of fellowship over there in Australia, how would you do it, especially in psychiatry?
I think from a clinical perspective, and also from theoretical knowledge and all that stuff, I think India is very well placed. I've done my training in India. So the amount of books that I had to read was quite a bit, uh, you know, when I was doing my postgrad in India. The amount of patients that I saw was probably a lot more than the amount of patients I see here. Uh, I think where Australia wins in the training bit is the whole sort of absolute concrete structure to how they look at things. So they're very, very specific on what kind of psychotherapy training they'll give you, what kind of supervised practice they want to sort of have you undertake. A lot of the documentation bit is very, very to the point. It's ideal practice in a way. So I think the basics, at least in India as well, are all there. It's just refinement of what we already do in India is, I think, the main core issue of training in Australia. That's where I think Australia really shines compared to the Indian system. But in that, I mean, having said that, I think both the systems have their own pros and cons. India is doing the best it can with its system, and I've worked in that system and thoroughly enjoyed working in the Indian system. I've worked in Australia, and it's difficult for me. It's been difficult for me to adapt over the last 2 years, but I'm beginning to now enjoy the system as well. So I look at it from a very balanced perspective. I think both systems have their own pros and cons.
And the gross difference that we see in the residency training over here in India and the fellowship over there in Australia is the number of years that you have to spend through the training. So why is that difference?
I don't really know why that difference is, but I don't think I've never had a trainee or a colleague of mine complain about how long it is in the training pathway because they're really well paid here.
Hmm.
So I don't really feel that that's too much of a concern for any of the trainees. I suspect though it could be because the number of patients we see here and the amount of hours we work here are definitely lesser than the hours expected in India. I can vouch for that because I've been a part of the Indian training system. Uh, you know, I mean, I look back on my postgraduate days in India and I compare that to, let's say, how I'm expected to where how much I'm expected to work here, and the difference is vast. And I'm not glorifying India because I don't even think that's fair, but it's just a system in India. So it is probable that because the Indian system it compresses your training into 3 years because you have to work so much, you know.
Mm-hmm.
So I mean, I think I took what, like 2 weeks of leave in the entire 3 years, which is unheard of
Mm-hmm.
over here. So maybe it's and that's common. I'm not the only one. Like there's every second postgrad you meet in India is doing the same thing. So maybe it's just that. But like I said, I don't think that's a major issue, or because they're so well paid here. You're treated so well over here. Uh, that you don't really mind doing the 3 years. I mean, I've done an extra 2 years in addition to my 3 years because I had to complete 2 years here, and it's been fine. It's been good. There's been no problem as such.
If I tell you to compare and contrast the structure of residency training, I think it is much more organized there in Australia with proper rotations into each subspecialty of psychiatry. While we don't have here in India that you have 6 months of rotations in child and adolescent psychiatry, 6 months of rotation in geriatric psychiatry. Uh,
Hmm.
so what would you say about that?
But I mean, I have my own take on this because in Australia the system is 3 years of basic psychiatry, and then you can train extra as part of quote unquote advanced training the last 2 years. So the 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 benefit of India is that you have that flexibility of training, having going through an advanced training abroad after finishing 3 years while still being a consultant in India. So I kind of like that system in India. I honestly, that system to me makes more sense because although it's structured here, but there may be people who don't really want to do child psychiatry, or there may be people who just want to do general adult psychiatry. You know what I'm saying? So
Yeah.
India gives you that freedom. India doesn't force you to do an extra 2 years where possibly it may not be the best use of your time. So personally, I feel that in that way, even though it's not as structured, in my personal opinion, is that gives you more flexibility in terms of your career and what your future goals are and how you can kind of place yourself. So I would kind of, in that way, choose that system.
Yeah. Uh, And what about the super specialty training? Like we have 3 years of DM courses, although there are very few seats over here in India, but we do have 3 years of DM courses over here in India in the addiction psychiatry, geriatric psychiatry, and so
Yeah.
on. So,
Well,
what is the status
I
here in Australia?
to be honest, I've met many psychiatrists who've done DM in India uh, while I was in India, and after coming here, I realized that the level at which the DM training is happening in India is just it's not good, right? The advanced training over here is just way too superior to the DM courses that we're offering to graduates in India. Which is why, to anyone who wants to sort of specialize in a subspecialty, I would always recommend come on an STT pathway here and do advanced training here because there's just no comparison between. So, like I said, for someone who just wants to do general adult psychiatry, India is great. But if you want to specialize into a subspecialty, I think you cannot compare the training process of Australia versus that of India because it's so structured. If I get into the nitty gritties, there's a lot of sort of entrustable professional activities and workplace based assessments and all of that stuff that you have to get ticked off. Then there's in training assessments, observe clinical activities. There's so many things that you have to sort of go through here in a very structured format. That advanced training bit is just way better over here, as I would say. Because in India, it's just I know how DM works over there because it's that really weird mix of already being a consultant, but then still being a trainee.
Yeah.
So the other consultants in India, what they don't, even though you're a trainee, they don't really treat you like a trainee. And so the training process in that way is compromised because the whole sort of professional ethics and all of that stuff just gets mixed up. So I feel that in terms of advanced training, definitely Australia would be far superior.
Yes, and the advanced training there in Australia is in addition to the 5 years of fellowship.
No, you have two options. You could either do advanced training after after 3 years, and then the remaining 2 years you could do advanced training. Or let's say I become a consultant, right? I'm going to be a consultant in July. If I want to do advanced training in any of those specialties, I can still apply and do advanced training. It's
Yeah,
up to me. Even though I'm a consultant, I can still do advanced training.
and that is how many years?
2 years.
Okay, so either you become, specialized in a subspecialty after 5 years of fellowship or 7 years of fellowship.
No, after 3 years or after 5 years.
Okay,
See, in Australia, the first 3 years are general psychiatry, then the remaining 2 years are advanced, um, the subspecialties and stuff. So it's total 5 years. But in my case, let's say if I wanted to do, I mean, I'm a graduate from India. I come here, I become a consultant, and I can then undertake more advanced training if I want to. And it's the same for any other. Because let's say I have an interest in both addictions and child psychiatry, right? So what I'll do is I'll do 3 years of general adult, then 2 years of child psychiatry, then another 2 years of addictions.
okay,
So it's up to me. Like it's either 3 years or 5 years. You
okay,
know.
yeah. So you summed up the structure of training in psychiatry quite well. Now I think we have a question from Dr. Bhavya. So handing over to Dr. Bhavya.
Yes. So adding to Dr. Divyam's question, I would like to
Mhm.
ask that what is the weightage of psychotherapy given in the Australian training? Whereas in India, we know that due to high volume of patients, we don't have the time to practice psychotherapy, and also not much emphasis is being paid to psychotherapy here.
Well, to be honest, I don't know what system you're training in because I trained in Karnataka. It was a college in Belgaum, so we used to have psychotherapy training every Wednesday, and I actually ended up having a few clients who I followed through for more than a year, right? And in my opinion, it's pretty similar to how things work in Australia as well. The only difference is there is one psychotherapy written case, which is a patient you followed up for at least 40 sessions on which you have to do a big write up. That's part of the training. That's one thing that has to be sent to the college, and the college says whether you pass or you fail that assessment, right? Um, as part of my own training, because I remember filling up my logbook and submitting my logbook for the college process here. Uh, it wasn't much different except for the written long case. I didn't have to write the long case because effectively every patient that I was seeing as a psychotherapy client would be discussed next week on a Wednesday. So, and I actually had I think between 15 to 17 cases that I had did psychotherapy with. One of them was a person who I followed up for more than a year and a half. So that was a long case. So I was exempted from doing that because I'd actually done that in my postgraduate training. And it was that I could produce adequate evidence of having done psychotherapy. But a lot of people are not exempted from that requirement. They once they come, they have to do that. So because the Australian system does recognize that there are centers where very little psychotherapy is being practiced. So I don't know what system you're coming from, but from where I came, it was part of the curriculum, and we actually had to do all of that stuff. So for me, it was exempted. I did not have to do any of that stuff.
Right. So you mentioned that it's required to undergo a long written case in psychotherapy there in Australia. So,
For any patient that you've done 40 sessions or more for.
but is it for a specific kind of psychotherapy
It
required?
can be no, it can be any psychotherapy. It just has to be you have to pick yours, which one you want to focus on. I think the most common one is cognitive behavior therapy, and then you just go along with it.
Right. Great. Further, I wanted to ask regarding the contrast between the clinical presentation of the patients here in India,
Hmm.
there in Australia, because,
Hmm.
uh, for example, we see a very less patients of eating disorders here in India, whereas it
Hmm.
might not be the same there in Australia. So I wanted to
Hmm.
know about the differences between the OPD and IPD presentations of the patients.
Uh, I think the main difference between the kind of presentations we see here versus the ones that I've seen for many years in India is personality disorders. That's the main sort of difference. Other than that, most presentations, to be honest with you, like psychosis and depression, are pretty similar, except that over here, India, you have a lot of alexithymia, like people aren't able to really tell you how they feel.
Yes.
Over here, they just tell you how they feel. So it's pretty straightforward when they tell you what they're feeling. It's not that hard to elicit, let's say, because in India, you have to literally sort of ask them 10,000 questions before they answer you what you need, from the criteria to be able to diagnose this person. But over here, they'll tell you because they speak good English and they're psychologically minded. So they'll actually tell you all of the things as they present in the textbook. So it comes across as, you know, tuck, 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 tuck. It's all the criteria are met once they start talking. But the difficult bit is the personality disorders because they're really, really challenging cases. That's not something that I've had. I wouldn't say. I mean, I've had experience with everything, but I wouldn't say I've seen this many personality disorder patients in India.
Yes. So does that make psychotherapy easier as well in Australia as compared to India?
See, the bottom line is, if you want to be successful in Australia, you better have very, very good English because everyone communicates here in English, right? If you don't have good English, you're really going to struggle. I've seen people come from India, like in front of me, who've come here, joined the service, did not have good English, had to go back, right? So the only thing that makes the I mean, the most important thing that makes a difference in how you're able to kind of progress in your career here is how well you're able to actually communicate with patients. And so I would say it's not the personality disorders, it's your style and way of communicating that kind of makes the difference. If you don't have good English, it's going to be really challenging for you.
Right. Right.
And the same goes for the written exam. So I actually had to do a written exam as well. It's called the modified essay question exam. And it's so difficult in the way that you have to kind of not just think. There's literally I had 30 seconds left on the clock before I finished writing, and I write really fast, like really really fast. So I can imagine people who don't write as fast as me, how they would kind of you know struggle with this exam, because a lot of local Australian graduates don't pass the exam on the first go. It's very common for even local Australian graduates to pass this on the second or the third go. I thankfully I passed it on my first attempt, but it's not. I mean, the routine is that most people take 2 or 3 attempts to pass that exam.
Right. So a good whole lower English is a must requirement then.
Yeah, it is an absolute must. You should have better than average English for you to be able to succeed here, for sure.
Yeah. Moving forward, we know that the help seeking behavior in India is that the patients would not come directly to the psychiatrist. They will go first to the GP, or in case of schizophrenia, to the faith healer, and then they will come to the psychiatrist. So, how is that different in Australia?
To be honest, I mean, a lot of people there is some taboo with in relation to mental illness over here as well. Not as much as India, but I would still say that people have a little bit of a reluctance to sort of see a psychiatrist directly. However, having said that, people are definitely much more open to kind of seeing a psychiatrist, getting their mental health in order, getting the medications they need. Uh, they do over here. The structure is such that all patients must go to their GP first. If the GP is unable to manage them, only then they get referred to our service. So that is the structure. So they do go to their GP first and have themselves treated first from the GP. If they are unable to manage there, that's when they get referred to our service.
Right. Thank you, doctor. I'm now handing over it to back to Dr. Divyam to continue.
Yeah, so Moving on with the healthcare delivery systems in Australia, my question was that who pays for the patient? Like we have different models of financing healthcare, like we have the out-of-the-pocket expenses, we have in the insurance companies. Here we do have the government system paying for the patients in India. So how is it in Australia?
In the private sector in Australia, it's very similar to how the Indian system works. It's all insurance companies. If you take a good cover, will definitely provide you with mental health cover as well. For all, there's a universal health cover as well for all citizens and PRs over here. So if you're a PR or a citizen, you get access to free healthcare. So all our clients who are unable to afford private or whatever, they will have access to our services by default. So the government pays for that. If you have private health insurance, then if you pay the excess and the rest amount, of course, you don't have to pay. The insurance company reimburses you. It's pretty straightforward, very efficient, very fast. The systems over here are very, very, very efficient. I know this because I actually used to run a facility in India where I had to write up forms for insurance companies, and the insurance reimbursement, the rate of insurance reimbursements in India is just atrocious. Whereas over here, it's just almost instantaneous. You send across your documents and the reimbursement is done. It's pretty straightforward here.
Yeah. Uh, how much time do we have now? Is it 10 minutes more or 15 minutes?
Yeah, 5 or 10 minutes. Yeah.
Okay. So I would also like to know about the specialist pathway, because we have talked about the AMC pathway. Now let us switch on to the specialist pathway of RANZCP. So please educate us about that.
Well, the specialist pathway is the one that I'm on. Essentially, it's once you finish your training in your home country, you can apply for assessment, in terms of equivalence to what an Australian psychiatrist would have done. And that assessment, that process of assessment and then going through what they need you to do is what is called the specialist pathway. I went through the specialist pathway in 2023, where I applied, and then went to the interview, and my application was upwards of 150 pages long, right? So it's a very, very extensive pathway so because I had so much mileage in terms of 9 years of experience, I had to submit evidence of every single thing that I'd done after my post graduation as well, right? So it was a very long, stretched out pathway. Even then, I got a partial comparability and not a substantial comparability, which is very common for Indian graduates, right? Substantial comparability is going to be probably someone working as a professor in demands would get it, you know. So the general rule of thumb is if you have 10 years plus of work experience, you'll get a substantial comparability. That's basically the general rule of thumb. The idea is not to have to focus on the substantial comparability. The idea is to have enough experience under your belt in India so that the requirements they want you to complete under the partial comparability pathway are minimum. That's what one would aim for. So I was happy with the outcome I got. Most of the things were exempted for me. There was just a couple of things that I had to do. So the other things were all basics, term-based, etc. Now, the specialist pathway, once you apply to the college, there'll be a panel of 3 psychiatrists from Australia who will interview you, dig up everything that you've done in training, see your logbook and all of that stuff. So make sure all your documents from your postgraduate days are in order. And they're going to interview you in detail about your experience with respect to all of these different aspects of your training. And then based on their judgment, they will tell you whether you're comparable or not. Now, diploma holders are usually not found comparable. So in all probabilities, if you have a diploma with not enough experience, you may or may not be deemed comparable. I think there may be an exceptional case where if you have a diploma and you've worked as a senior resident for 5-10 years, maybe they may afford you some sort of comparability with a lot of requirements, but it's not routine. So once that happens, it used to be different earlier. Earlier, when I applied, it used to be that you take up a job and then apply for comparability. Now you have to wait for your comparability outcome before you apply for a job. So that's a difference. And as a comparable, after your comparability comes, even though you may be a consultant in your country, you're not a consultant in Australia. So you have to work as either a service registrar or a senior medical officer, or uh, in my case, a health service medical practitioner or a senior medical practitioner, depending on what jobs are available.
I've read somewhere about the area of need. So, what is that, and how feasible is it for somebody coming from India?
Look, I have not gone through that pathway, nor have I researched on it. So I'm the wrong person to ask, because my focus was to migrate to a city,
Yeah.
and I had no interest in moving to an area of need when I applied. So I come from a city. I wanted to go to a city. So for me, it was very straightforward. I did not read too much on what that pathway is.
Okay. And what does the future prospects look like for an aspiring psychiatrist uh, practicing in Australia?
The future prospects are great. I think, and this is again my take, but the practice of psychiatry in India is rapidly evolving, rapidly. It's becoming better and better, and in time, in maybe a decade or a couple of decades, it will align with international standards. Is what I expect. Based on all of my colleagues, I see what they're doing. Based on all the new setups that are coming up, I see a lot of progress in the right direction. For someone who's doing psychiatry in India, I mean, in Australia, who's come from India, I think prospects are great over here because the flexibility as a consultant is really unmatched. You can literally choose from anything between working from home, not seeing patients, to working in an emergency. So it's complete. The whole sort of spectrum of what's possible here is it's vast. Not and that's not so in India, right?
Mhm.
So you could actually work up a practice where you don't see any patients at all. You just write up files. That's another different kind of practice that you could do. Versus you could actually be like I do in triage, where I'm the first point of contact in the setup wherever the patient walks in. So that those are the two extremes between where you can kind of what you can do as a consultant. A lot of the private practices over here are telepsychiatry. So telepsychiatry has really changed the game. We do have a concept called the moratorium here. So if you've trained from abroad and you come to Australia, you're subject to a 10-year moratorium, which basically means that you can't do physical face-to-face practice in uh, central business district area, so which is the main part of the city. But because of telepsychiatry now, it's so easy to just start off private practice right away, because you could, there could be a patient living in some far-flung remote area in Australia who's paid for your appointment, and that you're exempt from doing that too. So, I mean, you're exempt from actually being barred from seeing that patient, so you can actually do that right away, right? But it's just it's difficult as someone who's trained abroad to come here and directly jump into private practice, because the regulations and the legislations are just, the scrutiny is just absolutely intense.
So it's not like NHS where you don't see a lot of people migrating to UK doing private practice, but I think it is much better there in Australia, where you can straight away start your private practice after doing the fellowship.
Yes, you can. If you have the PR, you can. It depends on whether you have the PR or not. And most people get that. So psychiatrists are in big demand over here, like big demand, right? So the prospects for this is literally the golden period for psychiatrists to make the move to Australia. This is the best time that there's ever been for psychiatrists to make the move to Australia, because they are in their current, lot of psychiatrists. They're all aging near the age of retirement, and so they do need young working guns basically. And so because of that, this is the best time to kind of make the move. It will not be better than this. I suspect,
And what do you
at
think? How
least for the
long it
next
will
5 or 6 years. I'm thinking 5 6 years is going to be really easy. After that, the challenges are going to start becoming more and more. As opposed to the US, because that's another country that I actually wanted to consider while moving. I think the US is currently slightly challenging, but in the next 5 or 6 years, I see the US becoming very easy to migrate to, especially because now they're recognizing specialist degrees from India as well in the US, which earlier they didn't used to, because they have a dire shortage of doctors as well.
And I think it will be easier for somebody like you who already has a fellowship from Australia.
Yes. So I actually came here basically for the fellowship. My main uh, reason for moving to Australia was to get this specific fellowship. That was my main purpose of coming here. My main purpose of coming to Australia was not to sort of come here, get into a job, settle down, etc. That may happen. I'm not denying that. But my main motivation to come here was to get this fellowship, because it's very prestigious. It's this fellowship is With this fellowship you can literally work in every country on the planet with no more exams and none of that other stuff that you have to go through. There's an automatic trust that comes with this fellowship.
Including United States?
Now, yes. So there are about 13 states that recognize psychiatry training from countries like Australia as well. So that is the landscape is changing in the US as well. And I trust that it will continue to change in the coming few years. They still have this requirement of taking the USMLE, but I think that may change in the coming years too.
And it's actually not a big requirement if you're not required to do the residency training all over again in the United States.
Yeah.
It's just a licensing exam.
Yeah. This has just happened 2 years ago. So anyone who wants to kind of do that can do that too. But places like Dubai and Singapore and stuff, they automatically recognize your degree. So there's no exam. You get the registration in like 10 days.
Yeah. Do we have 5 more minutes?
Sure.
Yeah. So I wanted to ask that if you want to transplant one thing from the Australian system to the Indian system, what would it be?
If I was to see something different in India?
Yeah.
Well, I think if I was to transplant one specific thing, I think, as Bhavya has mentioned before, I would say more stress on psychotherapy, because I think over here psychotherapy is really, really considered very seriously. It's not taken that seriously in India. There's not a lot of regulations in terms of who's practicing psychotherapy, whether they're qualified to do it or not in India. Over here, it's very, very strict, right? I think that's one thing that could really transform the landscape in terms of how we manage psychiatric patients in India, because over there it's still largely, medication based, where doctors are seen as the only people who are capable enough to treat patients with psychiatric illnesses. Whereas over here, we are the last stop. If nothing else works, that's when they come to us.
My next question is regarding the multidisciplinary team. Like we have psychiatrists, we have the clinical psychologist, the psychiatric social worker, and the psychiatric nurses. So we don't see a lot of multidisciplinary team and the coordination between all these units of the multidisciplinary team here in India. So what is it like in Australia?
That's the biggest culture shock you get when you get here, is because you're not used to working in a multidisciplinary team setting. That's the biggest shock that you'll get once you arrive here. It's very different from how we function, because in India, it's very paternalistic style of medicine where, the doctor comes in and then everyone is listening to just what the doctor has to say. But whereas over here, everyone has an equal say, and it's a great system to be in. Once you get used to it in the next, let's say 6 months or so, it's a great system to be in. In a lot of ways, it's much better than how we function in India, because everyone comes with their own perspectives on how they feel the patient would benefit best, and then a joint decision is taken after that. So I do think that that's a very, very nice system that I'm actually currently working in. All public hospitals have a multidisciplinary team setting. So they also have so they also have occupational therapists in addition to this in the team as well. And so specific patients will, let's say someone who's homeless or whatever, who needs some social work, will be allocated a case manager who's a social worker. Someone who's struggling with trying to do things on a daily basis will be allocated preferentially an occupational therapist as a caseworker. So someone who has, let's say, medical comorbidities will be allocated a nurse who's a case manager. So case manager is basically a patient who sees is a mental health professional who sees the patient once a week. They visit their houses once a week, just to check up on them and see how they're doing. It adds a lot of value to the kind of care we provide.
So that was amazing interaction with Dr. Sabharwal. Thank you, Dr. Sabharwal, for answering all our questions, and
My pleasure. Thank you.
you have really clarified a lot of doubts and hesitations and reservations that I had personally about migrating to Australia and about the Australian healthcare system.
Thank you. Thank you so much for having me.
Yeah, thank you.
Bye-bye.
Bye bye.